It's poison.
Imagine you are walking by a person yelling out things that doesn't seem to make sense. What would you do? Many people would fear and shun that person, cutting them out of the human community, which is why many experience schizophrenia as an alienating illness. Schizophrenia typically strikes people just when they are preparing to enter the phase of their lives in which they can achieve their highest growth and productivity. It affects 0.5 to 1% of the population, with typical onset in males from ages 18 to 25 years and 21 to 30 for women. Schizophrenia is a heterogeneous illness, typically triggered by some combination of genetics, brain structural differences, neurodevelopmental or perinatal complications, adolescent substance use, and differences in neurochemistry. 3 symptom dimensions characterize schizophrenia, which are psychoticism, negative symptoms, and disorganized behavior. The psychotic dimension includes positive symptoms, which presents with symptoms that are usually absent, such as hallucinations. Hallucinations can be auditory, such as hearing voices, olfactory and gustatory, visual, or tactile. Positive symptoms can also occur in thought instead of perception. Delusions are fixed, firm, false beliefs that are not a part of a person's culture or religion. Delusions can be grandiose, believing they are an extraordinarily important or famous figure. Religious, believing they are a divinity or condemned to damnation. Persecution, thinking people are out to get them. And nihilistic, in which a person may believe they are dead, dying, or the world does not exist.
Stop.
Negative symptoms are characterized by the absence of something that should be there, which include avolition, which is where an individual loses the ability to initiate or complete a task. Anhedonia, which is a lack of pleasure in activities the individual once enjoyed or feeling entirely emotionless or empty. And alogia, where the amount of speech is reduced in spontaneity and impoverished in content. Disorganized behavior includes disorganized speech, bizarre behavior, and inappropriate affect. Common forms of disorganized speech include tangentiality, where a person's train of thought wanders and never returns to the initial topic. Bizarre behavior may include catatonic stupor, where an individual will be immobile, mute, and unresponsive while being fully conscious. Echopraxia, where an individual may imitate the movements and gestures of others. And inappropriate affect, which may appear as smiling when speaking of sad topics or giggling for no reason. Many patients with schizophrenia lack insight and believe that nothing is wrong with them. Comorbid substance abuse is common, especially tobacco use disorder, with 90% of patients smoking cigarettes daily. Patients may need to be hospitalized if they are a danger to themselves or others. 10% of individuals with schizophrenia will die from suicide.
Don't jump. Jump.
Don't jump. Stop.
Stop.
They may also require hospitalization if they are gravely disabled and cannot provide for their own care. Treatment for schizophrenia includes antipsychotics to reduce positive symptoms, with increased benefit from clozapine and long-acting injectable medications. Cognitive behavioral therapy to reduce positive symptoms and increase insight. Electroconvulsive therapy for severe catatonic symptoms.
You need to go home now.
Social skills training, which is a type of psychotherapy that focuses on fostering the patient's abilities to relate with others and cope with the demands of daily life. And supported employment. People with schizophrenia, like all of us, do best when they find a supportive community.